First of all, welcome and thank you for coming today. My name is Esther McElfish and I'm president of NCTCA, North Central Texas Communities Alliance. And I want to welcome all of you. We've got a number of our members here, and I won't individually recognize everybody, but our Vice President, Gary Hogan, is here, and a lot of our loyal, hardworking members, and we're very pleased to see you, and thank you to the press for coming out today. And Dr. Neil Carmen has driven up, God bless him, from Austin today, and he's going to go back down to Austin because he's working on small things like the tar sands project and other things. So we really, really appreciate him taking time, and I will introduce him more completely in just a moment. The purpose of our little get-together today is to comment on the research that NCTCA has been doing over the last 6 weeks regarding Fort Worth's air quality study report. You don't need to move something. I'm so sorry. I'm sorry. I just fouled it up there. And as you can see, we've called it inconclusive by design. Inconclusive by design. And I'll tell you why we're here today to explain this. We're here to represent the citizens of Fort Worth and citizens throughout the Barnett Shale in Texas who have been looking to this study as a definitive guidepost to make decisions about the air quality and the environment and how they're going to handle gas drilling in the Barnett Shale and other places. And we're here to say that not only was it flawed, but it was intentionally manipulated, and there is incorrect information, and we feel like it's watered down and not to be used as a benchmark. In case I haven't made myself clear, we consider it to be inconclusive by design, and I'll explain that statement to you. If you want to have a study that is weak or shows little or no pollution or toxins in the air, then you design a process for that study that will give you that outcome. And we believe that that is what has happened with this air quality study and report. And the blame falls squarely in 3 entities: the city staff, Mayor Moncrief, and the City Council, and ERG, all equally at fault and complacent and compliant in this process. And we're going to explain that to you without going into too much technical data today. We have information that Dr. Carmen has given the members of the press here that will substantiate what we're going to say. But what we want to do today is very simply tell you what we've uncovered in our 6 weeks of studying this information and material and connect the dots and how we came to these conclusions, because we're not stating this lightly. We have really done our homework, and we have found that there's substantial information to back up our claims. First of all, let me introduce Dr. Carmen by just saying, first of all, before he makes his comments, that he has an excellent background on the other side of the fence. He spent 12 years with the TCEQ as an inspector, and he knows how studies are done right and correctly and how they're not. And so he brings that unique perspective to our team. I called upon him as our group was working on this and digging through the 400 pages of that study report. And we asked Dr. Carmen, because he's very adept at looking at the numbers, looking at the data, and figuring out what's real and what's not. The first thing I want to point out to you, and I'll talk about these just very briefly, but this chart, and I think each of the media folks has it, is in the study. And one of the things that we've noticed is that ERG intentionally misrepresented the information that they've told the public. For instance, there were 8, by the claims of ERG, there were 8 ambient air testing sites. We have found that that's a lie. There were actually 6. They state 8, but 2 of those were temporary, and only on a short-term basis. They went out to study one drilling site before they drilled, and it was a temporary testing. They went to another one before they started fracking, and it was a temporary testing. And the other sites that we're going to show you have very weak information, and Neil will go into that. But for instance, in this chart that's in the study, ERG's work was very sloppy. they gave us incorrect coordinates on one of the sites. So if you were trying to look at it and make determinations about the study, we kept finding errors like that and incorrect information, and this was one glaringly. Out of these sites, the first one says background testing. We don't need background testing. TCEQ does background testing on the motor vehicles and what's in the air. We don't need to be paying extra for that. We were paying for testing on gas drilling and that effect in our city. Mobile sources, same thing, and we'll show you some of these maps here where that's basically what they were testing was vehicular traffic and the air quality the toxins as a result of the mobile testing. Again, that's not going to tell us about the air quality problems with the gas drilling. It's about the mobile sources, and we don't need to be paying $1.2 million extra to have that kind of testing done. We wanted the gas drilling. On the other sites, they were saying high density in some of them. What we have found, and we have information to substantiate it, is that some of those sites were not, they had wells that were shut down. When they said high density, there might have been a number of them around there, but some of them were shut down, or their production values were down. And we had some people who, God bless them, crunched those numbers and went through those charts and went through the production data to actually compare as best we could pre-testing period numbers, post-testing period numbers, and during the time of the testing to see if there was a variance, and in some cases, yes, there was. Now, one other glaring example, and this is what we mean about how, this is one of the best examples of how this study was manipulated. The sites that were chosen, and we've given you the information about the list of the weather bug stations and the weather testing centers, we tried to figure out how they determined to set up these particular sites for the testing. And they correlate with the weather bug and weather stations. Not that they were in the neighborhoods. One was out at Meacham, where it's wide open spaces. Two, not one, but two, were at Spinks Airport. Does this look like it's a neighborhood, a high-density neighborhood where you're going to get information about the results of gas drilling in our neighborhoods? That's why we say this was manipulated and designed not to find the kind of information that we want to find as citizens. If you're testing in a neighborhood, you have buildings, houses, schools, churches, trees that will keep that pollution in. In these areas where the testing was done, it's dissipated. Not one, but two sites at Spinks. And if you know where Spinks Airport is, south of town, off of 35, again, you're testing for vehicular traffic off of 35. You're testing almost into Burleson. You're there at the border of Burleson, not in the heart of Fort Worth that we were paying for. And there's aviation pollution to consider as well. Same thing with Meacham. So out of these sites, you have very little where it's in the high-density areas that most citizens anticipate. And most citizens believe that there was going to be testing done in the neighborhood so we would find out what the impact was in our community. The other very important point is, on these, well, you'll see these charts, but you can look at these more closely, but this shows that there were a number of wells in the area, but then a number of them were not operative. They were low production or shut down. So when you look at the report, and God bless our people who actually had the patience to do this, because my eyes glaze over, but they actually went through that to go to the Railroad Commission records and see the production records and look at and compare the sites and look at the numbers and look at the wind patterns. The other really important point that we want to make on this, and Neil's going to go into some of this specifically about testing, is that most people, excuse me, let me backtrack, most citizens believed that this testing was done over about a 6-month period, 3 months, 6 months. When we've asked citizens, how long did you think that the testing took? Most would say 3 months, 6 months, a year even. In reality, the ambient air testing only went from September 15th to October 20th, about a 5-week period, and not total 5 weeks. Out of that time, and we got ERG to admit this to us, this is not just our theory, but in our conversations with them after their public presentation down at City Hall, they said that they put the canisters out every third day. They would put it out for a 24-hour testing period, and Neil's going to address the problem related to that because that dissipates the emissions for 24 hours. But they would put the canister out for 24 hours, go back in 24 hours, pick it up, take it to the lab, repeat the process on the third day. So in reality, we were only getting about 20 days of ambient air testing. Not 3 months, not 6 months, not a year. Now we had point source testing, and Neil's going to address that other problem as well. They go out with a little camera. If they detected an emission, they do some more testing up close. If they didn't, they were moving on. So we didn't really get a sound testing procedure, and that's why we say inconclusive by design, because those points that I've just mentioned to you highlight how weak this testing procedure was. And Neil's going to talk about that and what makes a credible study. But I just wanted to highlight some of the things that we found and why we say that it doesn't anywhere near address the problems that most citizens thought it would, and it certainly was not the value for $100.2 million. So I'd like to introduce Dr. Neil Carman to you, and I'm just going to tell you briefly about his very impressive background. He's worked on environmental pollution issues in Texas for over 30 years, and I've known him through that time, by the way, and he's one of the hardest working, dedicated people you'd ever want to meet, a scientist. And he began as a Texas state air pollution official, working for 12 years investigating industrial pollution sources for violations of state and federal laws, and by assisting communities dealing with air pollution impacts. He has served for nearly 20 years as an environmental scientist with the Sierra Club Lone Star chapter in Austin. As an investigator for the Texas State Environmental Agency, he has done the following. Number 1, conduct air pollution sampling and analysis at industrial plants, including natural gas processing plants, oil and gas operations, oil refineries, chemical plants, and others. 2, participated in stack testing and stack test observations. 3, evaluated and reviewed environmental testing procedures, including real-time air monitors and remote sensing technology, and he will address that very point about real-time testing. 4, performed compliance investigations at industrial plants. 5, responded to citizen air pollution complaints about odors and chemical emissions, and that's one of the things we find weakest in this study, that it does not address some of the real problems. 6, worked on air pollution enforcement cases. 7, gave expert testimony in state district court in enforcement cases. 8, reviewed proposed federal and state regulations. 9, served on federal and state advisory panels. And 10, served as a technical advisor to citizens and industry on source reduction projects to cut toxic emissions. He's also provided technical assistance to dozens of communities impacted by industrial pollution in the United States, Canada, and Europe. I'm getting impressed, Neil. 12, he's performed technical reviews of permits, and that's very important in this and how he was evaluating what he saw in this study. And then he also has spoken, and I've heard him do this very well at public hearings on pending regulatory changes and draft permits. So he's observed firsthand for over 3 decades how children and adults are harmed by pollution exposures in dozens of communities, and he's dedicated his life to pursuing proactive public policies. One of the things that we found most important about this is that it doesn't address the solutions to act on those now. ERG made some recommendations, but here we are a year and a half later from the first time they started talking to groups like NCTCA and citizens about doing this study. And have we seen any change? No. Have they addressed it? Are our children healthier? Are our citizens healthier? No. And that's what we want, is action, less studies, less wasted time and money, and more action. So With great pleasure, I introduce Dr. Neil Carman. We are very honored he is here. Let's welcome him, and he's going to address some of these points. Thank you.
Thank you for the opportunity to come to Fort Worth and talk about the gas drilling activities. I've been aware of this ever since the beginning because people began to contact me. My concerns about the ERG study is it's flawed and it contains serious gaps. One of the flaws is the fact that ERG did not use state-of-the-art ambient air monitoring technology. This is technology that's been available for nearly 20 years using ultraviolet, infrared laser technology, for example, and other types of remote sensing systems. ERG could have used real-time remote sensing technology, but instead they opted to use 24-hour canisters. The problem with the 24-hour canister sample is you get an average, and that depends upon the wind direction, the wind speeds, these kinds of meteorological conditions, and also the way the sample pump operates. Typically, it's usually not 100% of the time. It might operate maybe 15 to 20 minutes out of an hour. So out of a 24-hour period, you're only really getting a few hours of actual sample. But the real problem is that if you want to see the highest concentrations of formaldehyde, benzene, and other gas emission components, you're not going to see them in a 24-hour sample. A simple analogy is our speed laws in the United States are based on instantaneous values with a police officer using a radar gun. There's no law enforcement agencies in the United States that have a speed limit that's based on a 24-hour average. No one would ever get a speeding ticket if you could average for 24 hours. So 24-hour averaging is a way to get low pollutant values because there's a whole number of variabilities. As I mentioned, the wind speed, the wind direction change. I did a great deal of monitoring for the Texas Commission on Environmental Quality around industrial plants, and the wind shifts around a lot. So if you want to look for the highest pollutant concentrations of benzene and formaldehyde and these other chemicals, you need to go out there and you need to do very short-term sampling and real-time monitoring. This issue has come up big time in the Houston area around refineries and chemical plants. And so in the last 10 years, there's been a huge effort to fly aircraft, have people on the ground with laser gizmos that can get real-time measurements of these highly toxic substances and not look at a 24-hour value. Another problem with the ERG study is they did not take into consideration that these wells operate at different production volumes, and we don't even know if some of them may have been shut in. Okay, I used to go to natural gas processing plants every year, and the well activity changes a lot over time, even from day to day. But we don't know from the information in the report if some of the wells were shut in, if they had low production volumes, if they were high. There's no evidence. And this is important because when I did stack testing for the state, or I did observations of contractors, the plants were required to run their boiler or heater compressor at maximum capacity to see what the maximum emissions were. But in this study, we don't have a clue as to what the production volumes were or the rates from any of these sites that they tested. Another major concern with the study is upsets. Again, whether you go to Houston or any industrial area around the country, there are problems, malfunctions, upsets, electrical failures, equipment breaks down. Even a lightning strike will send a whole refinery or chemical complex into upset because, or power dips and so forth. So the whole thing is that agencies like the TCQ here in Texas, every day they get reports from industry around the state of upsets, malfunctions. The reason that these are important is because you get big spikes in emissions, okay, big jumps. So anyway, you can have levels, 10 to 100 times above the normal emissions. In the Houston area, when they flew aircraft over the plants, aircraft equipped with real-time monitoring technology, they saw levels of pollution, of benzene and so forth, 6 to 12 times higher over on an average. In one big refinery, it was 100 times greater for the butadiene they reported. So these facilities here in Fort Worth, Tarrant County, could be and likely are having some upset events, equipment failures, where you could have emission spikes, but you won't see it on a 24-hour canister basis. Upsets were completely ignored by this report, which I find incredible, having worked in the agency for 12 years, and we would get daily phone calls, even from gas processing plants and chemical plants, that they were having problems. And during those periods, their emissions would go very high. And people would complain a lot more. So the concern that we had is that with those higher levels of emissions above a normal rate, you would have a much greater potential for adverse human health impacts. But ERG never even mentions that. They didn't try to talk to the companies as to whether they had any upsets or malfunctions. Also, ERG did not even try to test all these facilities out there. They ignored flares, for example. Flares can be a significant source of emissions. We've seen that down in the Houston Ship Channel, and we've actually found out that the emission factors that they use to calculate the pollution from the flares are not correct at all. That flares can have a lot of pollution, a lot of benzene that doesn't burn up. Flares need to be tested, though, not with canisters, but with laser-like technologies, ultraviolet lasers, infrared lasers. This technology is not, new at all. It's been around quite a while. ERG also failed to consider the formation of what are called highly reactive volatile organic compounds. These are things that can form in the air very quickly. This has been seen as a huge problem in the Houston area, but 10 years ago we didn't know anything about it. But nonetheless, they didn't even consider it, and that could be, I think, another problem here in this study. They also did not evaluate complex mixtures. In other words, when people are breathing the chemicals from these gas sites, gas processing facilities, it's not one component, but it's usually dozens of substances. From a toxicological standpoint, this is very difficult to do, but nonetheless, people are being exposed to many different substances. So there's numerous flaws and gaps, and the study, I think, cannot be used in any definitive way. It cannot be used to say that there's no adverse health effects. In my own experience, I dealt with many citizens complaining even about natural gas processing plants when I worked for the agency. And it was when plants would have problems, when they would have equipment failures, or there would be a power failure in the area. And so these are major problems with the study. There's more I'm seeing. I haven't written them all up. But the study is so flawed and so riddled with gaps that basically my view is it's a very poorly designed and conducted study. Thank you. Yes.
Of course, the other side could bring their expert and probably say something opposing your view, your assessment of the study. What's the public supposed to think? Because they're at your mercy to understand this information. Sounds like it's sort of dueling experts to say both sides. And what's the public supposed to believe?
Well, I think this is where remote sensing technology can be used here. It's readily available. There's companies out there that have this. So I'm really shocked that ERG did not use state-of-the-art monitoring technology to look at the highest levels of gas emissions like benzene and formaldehyde and other toxic chemicals that are being emitted here. So, the problem is the technology exists to use state-of-the-art devices, monitors. Why didn't they do that? Why did they take an approach that is going to show lower levels with a 24-hour number in a canister? I saw this problem 20 years ago when I worked for the state. And what we found is that when you go out and you do the short-term sampling of 30 minutes to an hour is when you'll see higher levels. and actually even a 15-second sample. You can use a canister to take a 15-second air sample. They could have done more of those. They chose not to. These 24-hour averages are not going to show much of a problem, in my opinion, and based on my experience. It's a very poor way to try to evaluate if there's a potential for human health effects from the toxic chemicals that are being emitted by these facilities.
When you talk about shut-ins, what do you mean by shut-ins?
In other words, the well is shut down. It's not producing gas, so that can affect the emissions, okay, if it's shut off. And so when I tested for the state, if we were going to do stack testing or monitoring, and the plant said they were shut down, we weren't really interested in that. We wanted to get emissions in the plant or at the property line when they were operating, and so we tended not to do much sampling if the plant said they were shut down. It would affect their emissions. The emissions would fall in most cases. Very great.
May I mention also on your question, I have some copies here from segments of the study. I guess we didn't find the whole book back there, but we have some sections here for instance, like on the Mercado, the number 5 site, where it's showing, and I've highlighted that they have the wells shut in. We went back and researched those before we make any claims or statements. We wanted to be sure that we were doing that. The other thing I would like to add to what Neil just said, Dr. Carmen just said about the state-of-the-art equipment, we brought in, and Gary was with us, we had some people who brought in some equipment, Picaro from California, that had the real-time state-of-the-art technology and testing, where they could take a van, they had real-time testing, they had the camera and the computer in the van, and we rode around with them to a couple of sites. One, the site down there on Rosedale, you know, by the power plant, and Gary went one night, the night before with them, and there was a spike to a 12 or 13 reading, I believe. The next day when we went by, and everybody knows that the emissions oftentimes are higher in the evening when people are not monitoring or watching them. The next day when we went by, it was a 7 or 8 as we went by that facility. So that's another part of it, and testing was not done at night. And that's a big duh, you know, that we know that for a long time since they've been here, they have been testing. May I mention one other connection too, and I know you've got some questions, but this is important and I left it off because it answers one of your questions, Evans, about dueling experts. One of the big gaps in this, and this is like the big elephant in the room, is that Brian Berner, who is the former environmental director for the city of Fort Worth, had his hands all over this study. He was one of the main architects. He was the director of the environmental management department. It was under his guidance and city staff working in conjunction with Mayor Moncrief and City Council that the scope of the study was developed, that they selected the air quality study committee members, that they worked with the air quality study committee members to then select the testing company, ERG. And isn't it interesting that a year ago in August, when the city was having budget cuts and layoffs, they decided to move the environmental management department under TPW. They were cutting and consolidating positions, and Brian's position was eliminated, but oh, save the day, Chesapeake hired him. So right at the time when they had just completed all the important work of vetting the company, getting them started, ERG was just ready to do their testing, he had his hands all over this, and he was hired by Chesapeake. And I will sell you some swampland in West Texas if you think for a minute that Chesapeake and the other industry members, and we don't mind saying it, had a pretty good idea of where this testing was being done. And the other reason we brought up the sites, those sites with the canisters, these supposed 8, but actual 6, when we asked ERG about that, we said, did you stay at the same site during the whole time? Yes. Do you not think that maybe on the second day the industry kind of figured out where you were? And they didn't really have a good answer. They sort of stumbled around on that one. But that's what leads us to believe that industry knew. And if they wanted to gear it down, shut down, work their production numbers, it's hard for the citizens to track that, but we have a pretty good indication. That was a big point when this whole thing began, that the citizens emphasized, we don't want the industry to know where this is being done. If this industry knows when and where, it loses credibility. And so that was one of the big red flags to us when we saw this.
Forgive me for...
Carmen, I'm curious about the Summa canisters. In the report, ERG makes it clear that the Summa canisters can be held for 45 days before so much deterioration has occurred that they're no longer valuable. And ERG makes it clear that they held them generally just 30 days. To me, 30 days, particularly with some of the volatile chemicals in there, particularly sulfides, and I'm not a scientist, but it seems to me in 72 hours they're breaking down, much less 30 days. Would you think there would be a chance for some chemical breakdown or change in a Summa canister if, as ERG said, they generally got to test them at 30 days, within 30 days?
Yeah, I mean, my view is that the analysis of any sample should be done as soon as possible, because you can have degradation, you can have reactions going on inside of the canister between the different chemicals. You can have possible reactions between the compounds and the canister itself. So when I worked for the agency, we would get analysis as quickly as possible. Okay, we would be out in the field, we'd go back to the laboratory, we'd start doing the analysis right away. You know, the technology exists where they could have used like an automated gas chromatograph. They could have set it out near some of these sites, and they'd get a 24-hour some numbers, but they would get real-time data every 15 minutes of the levels, and you see it going up and down. You can still calculate a 24-hour average, but you get to see the real-time values of what's going on, and then also because the wind changes. So I think, you know, to me, this idea of putting the Summa canisters out there, and then you take a sample for 24 hours, and then you're going to wait 30, 45 days. I don't think it's not good. But basically, I feel the whole design of doing a 24-hour sample is flawed. You're not going to find much.
If I recall, not a scientist either, but the city and ERG said we set this up because this will average what people are. No one is standing there at that facility breathing in 15 seconds, a particular 15 seconds. In an average, that's what people might be exposed to.
Well, I think there's a real problem with that, and the whole concern is that the highest concentrations have the greatest for adverse human health effects. I saw that, and I've seen that over my 30 years when you go around industrial sites, and especially if they're having a problem and you get a burp or a hiccup or, you know, an upset. And that is a huge issue. Even though if you sample for 24 hours, it's a nice low number that looks like there's no problem, but then people say they got sick. So, you know, and a Summa canister is not a living, breathing human being. It can't tell you anything about adverse health effects. And children are very vulnerable. They have very high breathing, metabolic rates compared to adults. They're outside. Their whole system is much more vulnerable to any kind of toxic assault. So, yeah, I think, you know, these 24-hour averages are just, you've got to have the short-term numbers and then look at the, you know, the concentrations, because those have the greatest human health concerns.
And what did you make of the study otherwise? The finding of certain sites at certain times based on the inability of particular machinery to cap vapor release. That's what was cited primarily as the problem here.
Yeah, I agree that vapor recovery should be done at these facilities. That is something I began to see in the 1980s when I worked for the agency around gas production sites, even refineries. Because otherwise you're definitely going to be putting out more toxic gases than you would otherwise. And the companies could also save money by capturing those gases rather than letting them loose. So I think, there are some recommendations in the ERG study that I think Esther's going to talk about. Any other questions?
I have one. I had an environmental tester tell me that the fence line SUMA canisters were the exact wrong place to place those canisters. If you didn't want to find anything, they needed to do it at the point receptors in the neighborhoods where people were living and breathing. That having it too close, that the fallout happens further. Is that what you see?
Well, you get emissions that are both sort of fugitive, ground level type, and then you get some that are airborne. That can be, that's something that should have been looked at also. Again, that's another potential flaw in the way a lot of the sampling is done. That's why if you're out there with, remote sensing technology, you can put a laser beam up and you can go up and you can go down with it across the fence line. When the emissions are coming through, the molecules will show up and you can check at different heights and you can get real-time measurements right away. So this whole sampling approach that they used for the 24-hour averaging of the SUMA canisters, I think, was just a very bad idea. Maybe 20 years ago, this would have been more accepted, but not today. They're not doing this in Houston, okay? In Houston, they're using, these laser technologies that have been available for actually nearly 20 years.
No, you can stay here if you want, because we'll talk about this. I know you guys are probably ready to wrap up. I want to tell you, we don't just complain here. We talk about solutions. So you were asking about what we recommend, and NCTCA has very specific recommendations, and many of us here have been talking about these things for a long time. But in direct relation to this air quality study, NCTCA is calling for 4 immediate actions. Our dear Gary Hogan, God bless him, has served on both of the gas drilling task force groups that helped write the gas drilling ordinance. He knows this stuff inside out and backwards, unfortunately. So we're saying that by October 4th, because tomorrow morning they're having a little discussion about this at tomorrow afternoon at Fort Worth pre-council meeting, we're saying by October 1st for the city to begin steps towards total audit and revamping and updating of Fort Worth's gas drilling ordinance. There are so many loopholes in it, it's like cheese, and it needs to be updated because we have found out so many things that need to be corrected over this period of time. Since when was the last one? 2008? So that's the first thing. Second, require vapor recovery technologies, and it's very cost effective. Neil can address this if you all want to ask more questions, but they can actually make money to pay for that equipment by the recovery of the vapors. 3, require larger buffer zones or setbacks, minimum, like Flower Mound just passed 1,500 feet. We have 600 feet, which is a joke because usually they get waivers. That means 200 to 300 feet, which is absurd. So we're calling for what South Lake, Grapevine, Colleyville, Flower Mound are doing minimum 1,000 to 1,500. And the number 4, I'm sorry, I don't know if you all can see this, new testing using real-time, state-of-the-art technology, as Dr. Carmen has recommended. So if you all have any further questions, I know you probably need to wrap it up or whatever, but thank you all so very, very much for coming, and thank you to our loyal NCTCA folks here. Thank you, Evans. Good to see you, man.